Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello, listeners. This is your host, Andy Curry. I am really excited today because I have Dr. Erika Burley on the line with me, who is out of North Carolina. Now, Dr. Burley is in general dentistry and has been since 1997. And her website is Burley Cosmetic Dentistry. And some of the things that she does a lot of is Invisalign, which we're going to talk about, and same-day crowns, which a lot of people may not know what crowns is, but we'll go into that. But same-day crowns is a little unusual because usually people have to wait. So I'm excited to hear about that. So Dr. Burley, welcome to the program.
Thank you.
Well, doctor, let's first talk about your education. Where did you go, first of all, when you went to college? Because usually you go to college, for your first 3 or 4 years, correct?
Sure, yes.
And where did you go for that?
I did my undergrad in Boston University, and then after getting my bachelor's, I decided to go to dental school, and I went to dental school at Southern Illinois University, which is in Alton, Illinois, right outside of St. Louis, and I did my 4 years there. And I still wanted to further my education, so I actually did a general practice residency at the VA hospital in Charleston, South Carolina. And I was so interested in some surgery aspects that I did an additional year at the Medical University of South Carolina after that.
Okay. Now, when I did the introduction, we talked about general dentistry, but it sounds like you've taken it further than that. Would that be correct?
Correct. I'm always interested in, learning more. What is new? How can I improve my services to my patients? And dentistry is evolving. It's no longer the day where you come in and you get drill and fill and you get to leave with the big silver filling and it's unaesthetic and the patient's not comfortable and they aren't happy with it and they dread coming back. So I'm all about, what can I do to make the patient more comfortable? How can I make it look better? How can I make it feel better? And how can I make them happy and smile more?
Now, what percentage of patients would you say are really trepidatious about coming in and being drilled on?
Easily 50%.
Really?
It may even be higher than that. Because there's always the patient that's not going to tell you that they have fears, but then you quickly start to figure it out after you start working on them that maybe they're a little more anxious than they're revealing. Even though I do in-depth conversations and my staff as well, some people are pretty good at hiding it. So, you just have to take your time and slowly go through things and find out because, sometimes patients do need a little oral sedation or something further to kind of make the experience more pleasant for them. Because I want you to not be fearful. So, if we can help you and alleviate your fears, then it's in your best interest as well as ours.
I've said for years that I've always thought women are tougher than men ultimately. Are they less fearful of dentists or men? Or is it kind of the same mix?
Honestly, I would say I have more men that come in and are phobic than women.
That doesn't surprise me.
Usually the bigger the guy, the more phobic they are.
Is that right? That's unusual. Well, not to you probably, but that kind of makes me laugh. That doesn't surprise me. Now,
big football player or somebody like that that's a little more phobic than the little tiny girl. It's funny.
That's interesting. Now, do you offer sedation dentistry if they get all wigged out?
We do some mild oral sedation. I don't do any IV sedation, but we do try to do some mild oral sedation for people. And for a majority of my patients, that's really all they need.
Mm-hmm. Okay. Now you said your website is Burley Cosmetic Dentistry. Now explain exactly what cosmetic means. Does that make them white, restoring teeth? What all does that mean?
So think of cosmetic as being anything that's going to improve your smile, make your smile more beautiful, and make you more confident. So whether that is you hated your silver fillings, you wanted to change them out to white tooth-colored fillings that blend in with your actual tooth, or you had some mild misalignment, your teeth were a little bit crooked, you wanted to straighten them up. You didn't like the shape of your teeth, so you wanted some veneers, or even as involved as you were having difficulty chewing and biting and functioning, so we needed to do some more in-depth work that involved crowns and things of that nature. So all of that encompasses cosmetic dentistry.
Okay. Now you are you do Invisalign, correct?
Correct.
Now Invisalign is a way to straighten teeth with a clear. I guess you'll have to explain that because I can't explain that.
Sure. Invisalign is a great way to straighten your teeth without having to wear those metal brackets. Of course, everybody thinks straighten my teeth. They think there's no way, especially as you become an adult, and you're even finding it with teenagers now as well. They don't want to wear the metal brackets. So Invisalign is a wonderful way for you to have little clear tray aligners. They look like little bleaching trays. Mm-hmm. And you change them out every few weeks. And it's changing, the alignment of your teeth as you change out those aligners. And we can get a lot of the same results that you could get by wearing the conventional metal brackets that people despise.
So if
and nobody's none the wiser.
If somebody's teeth is really crooked, can you still use them?
It depends on, how involved it is. Like you can still, a lot of times they want to take teeth out and things like that. Invisalign tends to not want to take the teeth out so much. Uh-huh. And it just depends on how far, you want the improvement to be.
Now,
but in terms of a lot of the aesthetics right there in the front, a lot of that is achieved.
Okay. Now, as far as straightening teeth with Invisalign, I think the listeners may think, isn't that an orthodontist job? How is it that they shouldn't go to an orthodontist versus going with Invisalign with a dentist in general?
Well, the wonderful thing about being a general dentist is I have to know a little bit about everything. I can't just know how to drill and fill teeth. I can't just know how to do root canals. I have to kind of be able to handle all sorts of situations. If it's a really difficult case, like, it's a child and, they're having as they're developing, their jaws aren't lining up and things like that, absolutely, I'm going to send them to an orthodontist. But if it's some minor cosmetic things, they don't like the way this tooth looks, that tooth looks, minor things, absolutely. We can certainly do that here in our office.
Okay, so an Invisalign works as long as there's not any complications. Does that kind of boil it down correctly?
Right. As long as there's not a whole lot of skeletal issues and things like that, Invisalign is a wonderful tool to use.
Okay. And how does that work? Do you wear it at night or during the day too, or how does that work?
You actually wear Invisalign for like 22 hours. So think of it this way. The only time you would take it out would be to floss, eat, and to eat. Otherwise, you're wearing it.
Is it difficult to talk with it in your mouth?
I think like the first day, because there's a little extra added thickness. But people overcome that very, very easily. And so many people are wearing them and you don't even realize they're wearing them.
No kidding. Oh, okay. Now, as far as same-day crowns, first of all, explain to the listeners what a crown is.
So a crown, people receive crowns for a couple of reasons. One, like I've had a root canal and then the structure of the tooth itself has been compromised by the root canal. And so it needs additional support, or they have a filling that they need and it's so big that redoing another filling isn't the answer. So you need something, again, that's going to give it more support. So a crown basically fits over the tooth. Think of it as like a hat. So the entire size of the tooth is reduced a little bit so that this crown or cap as people call it, a cap a lot, fits directly over it, nice and snug, fits all the way down so you can bite as you should, floss as you should, eat and chew as you should, and it'll look and blend in with your other teeth as well.
Okay.
So it restores not only function, but the aesthetics.
And you say you do same-day crowns. How is that possible?
I use a system called CERAC, and it's wonderful. You can prepare the tooth. You can get images with a computer camera, and there it has a milling machine that it talks to and communicates with. It's a crown, and you leave in about an hour and a half from start to finish.
Well, that's amazing because I'm used to waiting 3 weeks to longer.
That's the beauty of the same-day crown. So many people hate, like, oh, I have to wear this temporary. I really don't want to wear this temporary. Can you get it back any sooner? Can you call the lab and get it back any sooner? And usually that's not possible. There always is that 2-week average period of time that you have to wait, and patient has to wear a temporary, and they hate it because what if I lose it? What if it comes out?
Right.
What am I going to do? And so they're always worried about that and, conscious of when they're eating with it, what's going to happen? How can I keep it in? What should I do? I'm going on a long trip. What should I do? And this kind of eliminates all of that. You get the crown while you're here.
Very neat. Now, when you were done with graduate school, you got your 4-year degree, and you decided you wanted to go into dentistry. Did you always want to do that? Did something just suddenly spark that interest? How did that happen for you?
What happened for me was I was at that point where in college and you have to decide what am I going to do with my life. And I always knew I was going to go into medicine. And for the longest, I thought I would kind of be an MD. But then my actual dentist kind of needed some help that summer because his front desk was going to be on maternity leave. And he says, I know you're here just for the summer. It would work out great. Do you think you would want to come help me out? And I said, sure. And so I really just found myself kind of sneaking in the back to see what he was doing more than I should have been up front, helping the patients with their billing and their questions. And I really just became enchanted with dentistry. So it's something that at that point I'm like, oh, this is what I want to do. I decided right then and there from that summer.
Awesome. Now,
and I've loved it ever since.
You thought about becoming an ND, so you have the mindset to do the health and, quite frankly, the intelligence, because that's not an easy thing to do, medical school or dental school, because there's a lot of, that's hard work, isn't it?
A lot of medical school and dental school overlaps. Like, we both take gross anatomy to figure out, how the body works. Where does this nerve connect to? What is that? What reaction does it cause? What blood vessel fuels this organ? We all have learned the same information.
Okay.
We all take microbiology to learn about the little bits and tiny pieces in the body. So a lot of the things that you do in med school, you do in dental school as well. So we just think of ourselves as specialists of the head and neck, whereas, an internist or somebody else would consider themselves more overall body.
Okay. Now, how many siblings are in your family?
I'm solo.
Oh, you're solo? Okay.
Just me.
Now, are your parents, are they doctors as well?
No, my father was a minister, and of course my mother worked with him in the church.
Okay.
So no prior medical background.
Okay, that's interesting. You hear about families whose parents are doctors, and it kind of continues the tradition. So how neat that you're doing that. I have a good friend who is a dentist, and all of his brothers are dentists, and his sister is married to one. And I jokingly say, I'll bet Thanksgiving's a lot of fun.
I'm talking about teeth. Yeah. No, I know many people like that. No, I knew from probably like age 6, when people start asking you, so what do you want to be when you grow up? I always said I wanted to be a doctor.
I'll be darned. Well, That's neat, and we've done some checking on you, and you've got a great reputation, and we're very happy to have you here on the interview. Now, people who hear about you during this interview, they're going to want to know more how to get a hold of you in your office. So how can they do that?
Absolutely. So our office phone number is 704-364-7832. And our website, once again, is www.burleycosmeticdentistry.com. And Burley is spelled Burley.
Okay. Well, you heard it here, folks. And Dr. Burley, we're very grateful that you joined us for the interview today and sharing with us your information in your life and what goes on in your practice. Thank you so much.
Thank you for having me. It's been a pleasure.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.